I thank the distinguished ranking member and the dean of this institution for yielding and for his leadership, but it is even more powerful that the leadership joins with our distinguished chairman of the full committee, Mr. Goodlatte, because this is the beginning of our effort of criminal justice reform that certainly has been one of the guiding focuses of the chairman of the of the subcommittee on crime, and Mr. Sensenbrenner, who has likewise been a former chair of the full committee, but has steadily worked on thoughtful legislation dealing with the overall issue of criminal justice reform. I'm delighted to be the partner in this legislation and to be a co-sponsor and to work on this whole concept of dealing with opioids, but as well to deal with the question of criminal justice reform in a whole new attitude. And I might say that I heard words from Leader Pelosi yesterday evening as she received the Hubert Humphrey Award on Civil Rights. She indicated that there are three major issues that we should be governed by in this Congress. Number one, children. Number two, children. And number three, children. One might ask, why are we discussing children? I thought we were discussing the Comprehensive Opioid Abuse Reduction Act of 2016, and that we are. And I'm very pleased that it is a very forthright and thoughtful approach to this issue, and I support it. But it is a compilation, if you will, of many thoughts about how we should deal with the question of mass incarceration. And what does mass incarceration deal with? They deal with human beings. They deal with men and women. They deal with families. We deal with mothers who have children. And previously, if you were on any manner of drugs or you possessed drugs, nonviolent, you were incarcerated. If you were on crack or cocaine, you were incarcerated. But I commend the chairman of the subcommittee on crime, Jim Sensenbrenner, for his work, as I said, and Chairman Goodlatte and Ranking Member Conyers, because we now have, from the Judiciary Committee, a legislative initiative that does not have mandatory minimums. In fact, it deals with a passionate and compassionate approach, and it deals with the issue of addiction and recovery. The bill that I was a sponsor of earlier, predecessor to this one, the Comprehensive Addiction and Recovery Act. And I would be happy to see the committee pass that bill, but I'm pleased that we have been able to work together to produce an alternative bill that will help address issues related to opioid abuse. Again, I emphasize no mandatory minimums, but a way of addressing this question, Madam Chair, that I think will be long-term. I look forward to continued collaboration with my colleagues to find additional solutions to the drug crisis America now faces. We must take action because today a leading killer of Americans is drug overdose. Between 2000 and 2014, almost 500,000 people died from drug overdoses. Many of these deaths were preventable. In 2014 alone, more than 47,000 people died of drug overdoses. The largest percentage of overdose deaths in 2014 were attributable to opioids like prescription painkillers, methadone, morphine, and heroin. There lies the origin of this massive impact, including our juveniles, who find them in many different ways. Specifically, 28,647 people overdosed and died because of an opioid in 2014. We're experiencing an emergency that impacts citizens in every state, city, and town in this country, that is prescription painkiller and opioid abuse. This emergency is compounded due to the perilous connection between prescription painkillers and heroin. I get it. We understand that physicians who did take their oath very seriously wanted to provide the medical care, the legitimate medical care, when there was a massive response to pain from all of their patients and others. Prescription painkiller abuse is the strongest risk factor for future heroin use, but it came about maybe not through the prescription and the initial prescription, but information that patients should have about the impact of opioids, and what it does to the brain, what it does when you do not have it, how you become addicted. And so out of this, approximately 3 out of 4 new heroin users report that their use began with their abuse of prescription painkillers, initially given to them legitimately for medical reasons. Heroin use becomes appealing to those addicted to prescription painkillers because it is cheaper and easier to obtain. And due to its potency, heroin use tends to lead to addiction. The same kind of lack of information maybe led to a young woman in my district on hydrocone with 2 little babies in the car, driving and sideswiping 2 cars and killing an innocent person on a motorcycle.
The gentlewoman's,
I yield the gentlelady 2 additional minutes.
the gentlewoman's recognized for 2 additional minutes.
I thank you. Or the mother who gave hydrocone and alcohol as a prom gift to her son and his date. That date winding up dead at the end of that prom. The rate at which the occurrence of heroin overdose deaths increased is cause for alarm. In the 4 years between 2010 and 2014, heroin overdoses more than tripled. This legislation encourages the development of alternatives to incarceration that provide treatment as a solution to the underlying motivation for criminal behavior or conduct associated with mental disorders. We must make our best efforts. It puts police in a position to be trained to use those drugs that will help when they come upon an unconscious person, like Naloxone. It allows criminal justice system to talk to the substance abuse system. In essence, it increases the use and availability of those drugs. Addiction is a disease, we recognize that. And finally, if I might say that I started with children. Just today, Dr. Phil is here discussing the foster care system, and what he said that most children are taken away because of neglect, and that neglect is based upon the use of drugs. Now, that is a wrong direction. The direction should be that we keep families together, we invest, and we provide the training to provide them parental skills, and to get, if they're addicted, get them off of those addicted ways to be able to keep families together. Today I'll introduce a bill that provides for nurseries in the federal prison system for women in short-term nonviolent offenses, mostly drug offenses, to reinforce the value of mothers and children being together. This bill, even though it may not point to that, is an overall change of attitude that looks to America and says, we want you not to be addicted. We don't want you to be on prescription drugs and lead you to addiction after your illness is over. We want you to be cared for medically, but we don't want you to become addicted. And in order to do that, we're not going to criminalize you. We're going to give you treatment and allow the criminal justice system, police, prosecutors, and others to have an alternative to ensure that that can be done. I'm very pleased that we're on the floor today. I know that we'll have an omnibus tomorrow, and I hope that you will support the underlying bill. With that, I yield back.
The gentlewoman's.
And more proudly, it is from the Judiciary Committee, who is the holder of the laws and the Constitution of this land, and we are here indicating an admittance and a recognition that addiction and opioids and all kinds of addictions are not necessarily a criminal justice or a crime, and that we do not come to this floor in this bill with mandatory minimums. And so I want to follow up on some statements that I made on the floor yesterday and also in the Rules Committee, contrasting the contrast in the way we're dealing with the opioid crisis and the way we addressed crack cocaine in the 1980s. Many of those individuals from neighborhoods like mine, many of them still incarcerated. And at that time, I was not here. Congress took action that we're still trying to rectify. At one point, more than 80% of the defendants sentenced for crack cocaine offenses were African Americans, despite the fact that more than 66% of crack users are either white or Hispanic. As we work on other legislation to address the enforcement and sentencing disparities related to crack issues, we must re-examine our approach to that and other drug uses and issues, rather. I think we're on the right track. I think we're being fair. This week, the House has been engaged in a comprehensive approach to addressing a serious public health crisis involving heroin and other opioids. In my earlier statement, I complimented my chairman of the full committee and my chairman of the subcommittee because we are working together. Overdoses and deaths involving heroin are on the rise. While law enforcement has an appropriate role, and the bills recognize that the bills, including H.R. 5046 before us now, reflect a broader strategy that reflects the fact that this is an addiction issue. I know that Mr. Conyers and many others who are on this floor, Mr. Davis, we come from inner city communities, and we watched the young people of our community die and lose their future in life through crack cocaine. Accordingly, we are not raising sentences or impacting mandatory minimums, but we are funding anti-addiction mechanisms such as treatment alternatives to incarceration, and we're bringing in the police persons, the police departments. What a great idea. Criminal justice and substance abuse and police persons dealing with this issue in a non-incarceration mode. We're not adding to mass incarceration with all of the related and devastating collateral consequences, but instead we're incentivizing state and local governments to prevent, treat, and heal. That is why we should be doing, that is what we should be doing, and that is what we should have done for crack and cocaine addicts. We're learning. We understand now that we have a different pathway, but it is not too late. And so I'm saying to my colleagues here, as we are working together, we should find a way before Congress has completed its work on this legislation and send a bill to the President that applies a more comprehensive approach, or a comprehensive approach that adds to this very strong foundation, including treatment alternatives to those who may still be suffering from crack and cocaine addiction. I remember signing the sentencing, reduction bill that we had in 2009 dealing with the crack cocaine disparities. We came together as a bipartisan group. So I know that these are things that we can do. Ms. Conyers, you know I've had this issue and discussed it with you, and I hope that we can work together as we move forward, and our colleagues can work together as we move forward to look at these issues, because if we walk our neighborhoods today, from one inner city to the next, and maybe our rural communities, we will find those crack cocaine addicts.
Lady,
I'll be happy to yield.
I just want you to know that your recollection of the years before, where we've come from a more narrow focus, more punitive, and we now are seeing a newer strategy that is far more useful, far more successful than before. And I want to congratulate you for your perseverance and determination that we will still get it even better under control through our looking carefully at the results of our activities. And I thank the gentlelady.
I thank you. I look forward to working with all of my colleagues. And as I finish, let me just say that today, again, I'll be introducing the recidivism to end infant mortality and reduce recidivism bill dealing with incarcerated women. Many of those women are incarcerated because of drug addiction issues that involves possession or sale of narcotics. And what we're attempting to do, that if a baby is born in prison, we're attempting to recognize that they should not be separated from that mother, and to have some postnatal nursery situation in a pilot program to examine how that works, because we know that addiction in many instances has caused women to be incarcerated. There are many issues that we can look at, and I hope as we work our way through this, we'll find some solutions for those who are still addicted to crack cocaine and need some of the same similar services that this underlying legislation has. With that, let me yield back my time. Thank you so very much, and I yield back my time.
The gentlewoman yields back. The chair recognizes the gentleman from Wisconsin.